Hi everyone, I am Versha Sharma, the senior correspondent with NowThis. I'm here with the Michigan Attorney General Dana Nessel, who is thankfully taking the time to talk to us today about what's going on in Michigan with the pandemic. So just to start, I would love to hear from you just, how you're doing, because I understand that you have a member of your family who is immunocompromised and you were self-quarantining because of that.
So we're not doing very well here in Michigan. We have a very high number of infections and very high number of deaths as a result of COVID-19. We are third in terms of infections and deaths, certainly not third in terms of population in our state. So we've been hit incredibly hard. And as a result, the governor, Gretchen Whitmer, has had to initiate a number of emergency orders. And we've basically been in a lockdown position for a long time here. But the government's working very hard to do everything we possibly can to address the situation. And we're hopeful that soon we'll be flattening the curve and that things will start to get a little bit better than it has been here.
Right. So I understand that Michigan has some of the strictest stay-at-home guidelines in the nation. Can you talk a little bit about how the governor kind of came to that decision and why? What's the reasoning?
Yeah, well, I think that the governor was left with very little other choice if she wanted to adequately address the problem here and to be able to protect the safety, the health and the welfare of Michigan's 10 million residents. We were struck for a number of different reasons, but, we have a lot of international travel in Michigan. Michigan, as many people know, is home to the big three automakers, and they have a lot of connections with China and Europe and all around the globe. And so I think we had a lot of people that were coming into our state, factors. And of course, we've been hardest hit in the Detroit metropolitan area, which makes up, the majority of our infections and deaths so far. So as a result, in response, the governor has issued a dozens of executive orders at this point. And one of the things that the government here has had to make clear is that, travel and work should only be for things that are essential and other than work of that nature. We really have to be careful to make certain that if people don't absolutely have to leave their homes, not do many people are doing.
So I also understand one of the restrictions is banning travel to in-state vacation homes and prohibiting boat usage. So again, I feel like this is an example of the governor really taking this seriously in terms of what is essential travel versus non-essential travel.
Right. So, one of the things that a lot of Michiganders do is, we have such a beautiful state and people, a large number of people live in the metropolitan Detroit area, which is in southeastern Michigan, and people love to go up north. There's so many beautiful vacation areas. And but for during the COVID-19 crisis, whether it's, the summer or fall or winter, whatever time of year it is, we encourage people to come here. We have a very robust, travel industry, and, recreation and tourism makes up a very substantial amount of the economy here in Michigan. However, unfortunately, in our central parts of our state, northern parts of our state, the Upper Peninsula, we don't have quite as much in terms of healthcare workers, and the hospital facilities are not nearly enough to cover the types of epidemic types of situations we're seeing now. And so if we have people travel from southeastern Michigan, where we have a much higher percentage of people who are infected, and they go up north and it starts to spread around in the northern counties, the healthcare system simply will be overrun, and it will be overrun very, very quickly. They're at capacity often up there, even without a global pandemic. So it will be be an utter disaster in the event that it starts to spread up north. And so when you talk to local officials, who are mayors or city council members or county commissioners, what have you, in our northern counties, they're the first ones who will say, please, don't come up north right now. Stay home, stay in southeastern Michigan, or stay in the western side of the state, and come back up when it's safe to travel later.
That makes sense. And I think, unfortunately, some of the reactions that we've seen to the more restrictive orders are people who are upset about it, right? They may not be taking this as seriously. So what's been, the difficulty in convincing everybody just how serious this is?
Well, as I indicated, I think so many of our cases are really kind of concentrated in southeastern Michigan, and the numbers are incredibly high. So if you take Wayne County, Oakland County, Macomb County, pretty much everybody at this point knows somebody who's been impacted, somebody who's died, and especially in communities of color. I was talking to our lieutenant governor, who's African American, yesterday. He knows 15 people personally, friends and family members who have died. I personally know a number of people as well who have died at this point. And what is so scary and so sad is when I go through my Facebook feed right now, when I scroll through on Facebook, it looks like the obituary pages to me. That's how bad it is.
Yeah.
And so down here, I think that it's not quite as difficult in terms of getting people to understand the seriousness of it. But the further you move to the west side of the state, or the further you move up north, the fewer cases of infection where people have been testing positive, and the fewer deaths. So it's harder because these particular emergency executive orders obviously translate throughout the entire state. And that includes the areas where they're not seeing it as much and they're not hit as hard right now. Now, of course, the governor's mission and the mission of all of us who serve in elective government is to make sure it never gets to those counties. But the only way to do that is to make sure it doesn't spread. And the only way to make sure it doesn't spread is to make sure that people are staying at home. And so I hope that people, no matter where you are in the state of Michigan, and in all the very many other states, of course, that are impacted, that people know that if you don't have this problem in your neighborhood, if you don't have this problem in your city, if you don't have this problem in your county, it's because people are obeying the orders and they are staying home. And the more that people violate these executive orders, the more we are going to see this virus spread into communities that don't currently have it. So the best thing you can do to make sure that this doesn't come to a community near you is just listen to our governor and make sure that you heed her advice. Nobody wants to lose their business. Nobody wants to lose their job. Nobody wants to be prohibited from engaging in the types of activities that we now realize we all took for granted, and that are just a common everyday part of our life. But at the end of the day, we will all eventually be able to get those things back, right? And even if you lose a substantial portion of your economic well-being, you do have the opportunity one day to get that back. But if you lose your life, you'll never get that back. And that's the message that we need to send, is that all the other things that have happened, that at any other time, we would think, wow, this is the worst thing that could happen to me. But the worst thing that could happen to you is for you to lose your life or the life of one of your loved ones. And that's what we're really trying to prevent here.
Now, you mentioned the particular deaths in the African American community, and I think I saw on your Twitter you've called these sort of disproportionate rates staggering and horrific. So can you speak to a little bit of what you're seeing in terms of the higher rates of Black people in Michigan dying? What do we know about it, and what do you think the state can do about it?
So let me give you an example. These numbers are glaring. Michigan is comprised of approximately 14% of our population is African American. Over 40% of our deaths are African Americans. So when you talk about a disproportionate number, I don't know what else you can possibly point to than those very, very alarming figures. And all the things that I think a lot of us in this state and a lot of us in this country have been fighting for and talking about the great importance. And that means universal healthcare for everyone, environmental regulations to ensure that people are not being disparately impacted by air pollution or water quality, depending on where they happen to live. Even things like educational and employment opportunities. Many of the people out there who are being impacted don't have the ability to telecommute to work. They might be our food service workers, or maybe they work in public transportation or law enforcement or other areas where they would be subject to contracting the virus much more so than if they served in some sort of other type of employment. Even things in terms of the water shutoffs that we saw that disparately impacted communities of color and then aided the spread of the virus because people didn't have running water in their homes. Really the list goes on and on. And, I was talking to one of our representatives the other day, congressional representatives that many people know nationally, Rashida Tlaib, and she represents a particular area in her district that has the highest rates of asthma and the highest rates of respiratory disease of virtually any area in all of the United States. And that's due to a number of different types of heavy industries that are in this area, which is also very densely populated.
Right.
So what happens when you don't have the proper types of environmental regulations or environmental regulations that are enforced, and people already have these pre-existing conditions that have to do with respiratory failure? They're going to be the first ones who die from a respiratory-oriented disease like COVID-19. And so we're seeing it in droves, and it is impacting communities of color, African Americans, the Latinx community, Middle Eastern communities that live in those areas, and they're being impacted far more than other constituencies, I would say, in this state and other communities in this state. And so I think that that's something we're really going to have to take a hard look at when all of this is over, and when things settle down and the smoke clears, and we're going to have to reevaluate this, and we're going to have to again go back to these very important policies and better understand why this happened, why it impacted these communities more than other communities, and what we can put into place legally to address these many issues.
Is there anything you feel the state can do now to address those disparities?
Yeah, and I think the state is trying. I mean, certainly I would say Governor Whitmer and our representatives, we're doing everything in our power to ensure that there is more testing in the areas that need it most, to make sure that we have enough PPE that is being sent to those areas. I've been working in coordination with our United States senators and our United States congressional representatives to try to get the FDA as quickly as possible to approve some new sterilization techniques. And many of them are either they're chemically based or they're high heat related types of sterilization that you can use in a mobile tactical way. So you can have basically some sort of a van or other trailer that can just travel to a hospital, and you can load up some 80,000 pieces of PPE and have it be sterilized in a 24-hour period. That's the type of thing that we need to do immediately, and I know that we're working very hard to try to do that. But a lot of the issues are systemic, and they're not going to be cured overnight. And there are things that we're going to have to understand these problems and understand the great importance that they play. And we're going to have to stop sweeping these problems under the rug. And I will say, and this all ties in, I think, for what we're going to see in November, the communities that were most adversely impacted have got to come out and vote in the November elections. And whether you're voting for Congress or a United States senator or anything more local in nature, or state reps or state senators, and certainly when you're voting for someone to be president of the United States, you need to look at how this particular virus impacted you and impacted the community that you live in, and make a decision for yourself. Are you going to put up with this? Are you going to put up with the disparity in terms of the way that the virus has impacted people? And if you think that's intolerable, if you think that it's not fair the way that this virus has impacted your community versus other communities, you need to get out and you need to vote in November, and you need to find the candidate that will best represent you when your community is under fire and is besieged the way we've seen it now.
I think that's an interesting point, because it shouldn't, a pandemic shouldn't necessarily be partisan, but we are certainly seeing some differences in how Democratic state leaders are addressing the crisis versus Republican state leaders. So if, Michigan hadn't had sort of the 2018 blue wave in the midterms that it did, how do you think this crisis would look in your state? Like, how different would it look?
Well, I mean, the unfortunate thing is, and again, we know that this virus can impact anyone, right? It can impact you irrespective of your income or your geography or your race. However, we see that it is impacting certain areas and certain communities more than others. And I will say that traditionally speaking, in our state, Republicans have represented more rural and sparsely areas that have more sparse populations. And the urban areas, the big cities, tend to be represented by Democrats. It's been that way for a very long time in this state, and it's been that way, I think, in the United States for a while as well.
Right.
So we, in the 2018 elections, obviously we flipped the office of the governor and the attorney general and secretary of state. We gained a couple of congressional seats. And I will say, I look at, for instance, the 2 seats that we picked up in Congress, Representative Haley Stevens in the 11th district, Representative Alyssa Slotkin in the 8th congressional district. They have been working as hard as I've ever seen anybody work in terms of addressing this particular problem. I mean, all day, every day, they are out there fighting to get as much as they possibly can in the form of PPE or healthcare or tests or whatever they can to protect not just their own constituents, but the entire state. Our governor cares equally about all people in this state, and understanding that this has a disparate impact on communities of color, it was those communities that in large part assisted in terms of electing the governor. And I'm not saying that she only cares about the people that voted for her, because that's not the case with this governor at all. But I will say that I feel as though all of these communities are much better situated having Gretchen Whitmer be their governor than her Republican opponent who ran against her. And so I at least feel fortunate for that. But it's not enough, because obviously we need a federal government that also cares equally about communities of color. And we absolutely don't have that right now. And to be in a position where our Democratic governors have to beg and plead for their state to get the kind of equipment that they need, to get the kind of health care they need. And I will say right now, I am a part of a coalition of Democratic attorneys general that are defending the Affordable Care Act right now. The Republican AGs are fighting tooth and nail to have the ACA repealed. The Trump administration has refused to defend the ACA. And even in the midst of this pandemic, our Republican legislature was making an effort to have Medicaid expansion, which covers, nearly 1 million people in our state, repealed. Based on a challenge that was in the DC District Court involving the work rule requirements. So, when you talk about the necessity of understanding that healthcare is a human right, there's a big difference between the Democrats who are in office and the Republicans. And I think if you are a person who understands how important healthcare is, you absolutely have to understand that we have to elect more Democrats, because the Republican Party has largely abdicated when it comes to this very critically important policy issue. They're not interested in protecting people's health care. Democrats are.
Right. I understand, I think, that the ACA lawsuits were happening before the pandemic, but the fact that they continued to pursue it while we're dealing with a pandemic is just kind of remarkable.
Yeah, it's mind-boggling and horrific. I don't know what else to say. And that's the thing about the ACA. It's not as though it's only Democrats that get covered by the ACA, right?
Right.
There are so many people who have availed themselves of these programs, and who it's an absolute necessity to keep this in place, and no more so than now when there is this incredible health need and health crisis. And what we've also seen is that the people who fare the worst were the people who didn't have health care, and they developed pre-existing conditions in large part because they weren't being properly treated before this. And the difference is those are the people most likely to have died and who continue to die during this crisis.
I think it's also interesting how you draw it to other policies as well, like environmental policies, that those regarding pollution and industry have an effect on people's health and pre-existing conditions. So it really, so much policy is wrapped into this pandemic.
Yeah, I mean, absolutely, in really every way that you can imagine. And like I said, I mean, even you might think, well, what does public school education have to do with a pandemic like this? But the fact of the matter is that, the more educated you are on how viruses are transmitted, or even in terms of what your job opportunity is, it all boils down to, were you able to receive an appropriate and a proper and a properly funded public education? I mean, it's every aspect of life that you can possibly see. Transportation in Michigan is a really big deal. And I will tell you that I deal all day, every day with issues right now of price gouging. It's a very, very big part of the work that we're doing at the Michigan Department of Attorney General. And for a lot of the folks, one of the biggest problems is because we have such a dearth in terms of public transportation in the state, people are forced to go to their corner store. And sometimes it's the liquor stores where they have to go to buy their milk and their bread and their diapers. And so when you have price gouging, it affects people so much more when they live in some, impoverished communities where they don't have access to a car and they don't have access to other forms of public transportation, because whatever they got at that corner store, that's what they have to purchase. And many times they can't afford it. Even though in terms of how the virus spreads, the less money you have, the more likely you are not to be able to contain the virus for several reasons. One is you probably live in a smaller house or apartment. And so it's very hard for, say, one member of your family to self-quarantine if you live in a 700-foot apartment. You live in a 2,500 square foot house in the suburbs, that's a lot easier for you to do. But even in terms of purchasing certain types of items, so let's take things like hand sanitizer and disinfectants and finding a appropriate mask to wear. These are things, or obtaining bleach. These are things you absolutely need to have in your household if you're going to prevent the spread of the virus, so that you can properly be wiping everything down when you come home from the grocery store, the drugstore, or from your job. But if you can't afford those items, it's going to be much more likely that you or someone in your household is going to catch this virus. So that's one of the things that my office has been really active in. And in fact, we've taken over 3,500 complaints just since March 16th in relation to price gouging. In an average year here in Michigan, we take 80 complaints for price gouging in an entire year.
Wow.
So that's how this epidemic has affected the way businesses are operating. What I say to businesses in the state is this: listen, I want you to stay in business. I absolutely do. And I want you to be able to continue to employ people and to add to the economy. But you should not see this public health crisis as an economic opportunity.
Right.
And you should not be able to take advantage of people in a time where they need to be able to purchase these products affordably the very most.
So the 3,500 complaints that you've seen, that's Michigan businesses that are raising the prices for essential items, basically.
That's right. And not just inflating the items, but grossly inflating the items. And the way that we would quantify that is anything that is now put out as a product at 20% or higher from whatever that product would have been priced before our state of emergency on March the 9th. And that was done via executive order. We did have a Consumer Protection Act that allowed for my office to pursue these cases as civil offenses. But as of March 16th, when Governor Gretchen Whitmer issued an executive order on price gouging, it is now actually a criminal offense. So I can prosecute people because they have committed a crime when they price gouge under these circumstances.
So is the office involved in prosecutions right now?
We are. We have a number of cases, dozens and dozens of them actually, where we have initiated actions, and we've put out cease and desist orders. We've gone to court, and we are moving forward on a number of those actions, and it involves all kinds of things. I mean, we're not just talking about face masks or a disinfectant, but even the staples that people need in order to properly be able to shelter in place, diapers and baby formula, other staples, toilet paper, chicken, beef, milk. And we are seeing these products that are put out to market at exponentially higher rates. And you know what, if there's a disruption of the supply chain, then obviously that's something we understand. And sometimes you do have to raise the price that you put out this product to be sold for the public because you had to pay more for it as a business. But more often than not, that's not what we're seeing. We're just seeing businesses that are trying to take advantage of the public because they know that they need these products and that they're desperate for them and that their ability to go out and obtain these products is much more limited. And that's what we're trying to discourage. And what we've done is in our office, we've actually taken people from all kinds of other divisions in our office, and we've had to put many more people in our consumer protection division just to tackle price gouging, and then also the many COVID-19 related scams we're seeing that have, we've seen pop up suddenly just because the best way to take advantage of a person, unfortunately, is when they're afraid for their life. So every day we put out one or more new scams that we see coming up that are targeting people who are afraid for their lives.
And these scams are involving like treatment or alleged vaccines or something?
Yeah, it runs the gamut. So we've seen the COVID-19 defense patch, which is a patch that allegedly inoculates you or vaccinates you from the virus, which we know, of course, does not exist.
Right.
We've seen testing that you can purchase, that you can take at home, which of course is not FDA approved,
right.
And they're not legitimate tests. We've seen scams involving a person who will receive a phone call saying your loved one is in the emergency room, or is at the hospital, or is at the doctor's office right now, and they need emergency treatment, but the only way for them to get a ventilator is you have to prepay, and so I need your credit card information. What we've seen a lot of recently that's very upsetting relates to the stimulus checks. And because people don't know how are they going to get these checks, and of course they're badly in need of them. I mean, we've had, such a substantial portion of our population now that has very abruptly become unemployed. They need that money. They need it for food, they need it for gas, they need it for everything. And so suddenly people started getting text messages and phone calls and emails saying, well, if you want to get that stimulus check, you're going to have to sign up and provide your bank account information or your social security number or other sorts of private financial information. And people fall for it because they think it's coming from the Department of Treasury or it's coming from the IRS. And what people need to know is that is not how you get your stimulus check. It will automatically be sent to you wherever you filed your last tax return. So if you received a check in the mail for your refund, that's how you're going to get your check. If it was direct deposited into a bank account, that's how you'll get your check. And if you didn't file a tax return for the last couple of years, then you should directly contact the IRS. If anybody reaches out to you, it's a scam. Be careful. Don't give any of your personal information.
Now, in terms of some of these scams, I'm sure they cross states, right? Or some of them are national. So in that sense, are you working with other attorneys general in other states? And what does that coalition look like? I'm guessing you guys are more active as a coalition right now than you've maybe ever been before.
Yeah, so we have a couple of different coalitions that I work with. There's the National Association of Attorneys General, we call it NAG. And so we get updates multiple times a day. I get updates from NAG. And what will happen is when one state sees something, they contact the organization, they let them know, and then we get emails to all the AGs, not just the 50 states, but the territories, of course, who also have attorneys general, so that we can know whatever scam is coming up. I just got one this morning, actually, from Kentucky, and all the rest of us were put on alert immediately to know exactly what that scam was, and we've done the same. And I also work very closely with the Democratic Attorneys General Association, and we've worked in concert on a number of different things. Sometimes we work with the Republicans, sometimes not. It depends on an issue that we all share together. But, it's really important because this is impacting all of us. And as you suggested, the virus doesn't understand state lines, and neither do scam artists. And so we all have to work together to push back and fight back as much as we possibly can together.
And if people have complaints of price gouging or scams that they want to file to you, what's the easiest way for them to get in touch with your office?
Well, if you don't mind.
Yeah.
In terms of contacting our office, we have both a hotline, a consumer protection hotline, and we also have an email address. And it would be great if I could just pull that up for you, as I should be able to. Oh, here we go. So the number is 877-765-8388. And that's the hotline. And then our email address is michigan.gov/NAG. AG complaints. And we have a slew of folks that are available to take calls and who every day review all of the emails that come to us. And then we have investigators, a number of investigators that we've now put into this unit that go out to investigate these claims. And then we have a number of attorneys that are on this, and they are filing cases in court each and every day in regard to price gouging and in regard to these price scams.
That's great. That's really useful information. I'm glad that we talked a little bit about some of the more marginalized communities that are disproportionately affected. One thing I haven't heard a lot about is how this virus might be affecting the LGBTQ plus community in particular. Have you seen anything regarding that, or what are your thoughts on that?
Well, unfortunately, I think when it comes to the LGBT community, you have a lot in the way of homelessness, and obviously, and that especially, I think, goes for LGBTQ youth and also for the trans population. Because we don't have protections here in Michigan of any sort, there aren't federal protections and there aren't state protections. So we don't have a state civil rights act that protects sexual orientation or gender identity, which means you can be discriminated in employment, in healthcare, and it can be discriminated against in terms of housing. So anybody who is without stable housing is going to be a lot more susceptible to catching this virus. And I would not be surprised later on to see that a significantly higher proportion of our LGBTQ population actually contracted this virus and even died of it than the regular population at large. So, that unfortunately is a product, again, of not having the same rights, and also just general discrimination, which, again, if you're being discriminated against in all those other ways, it's going to impact you when it comes to COVID-19.
Is there anything else that you think people should know about how state attorneys general can be more active in addressing the pandemic, especially because of the gaps that we've seen in the federal government response?
Sure. Well, we have a number of different things that we're doing. We just actually, Michigan right now, and we're trying to get this out. I don't know when you're planning on airing this, but I think it's Friday that we're planning on sending something out. But, my office has been trying to coordinate with a number of different AG's offices to ensure that when it comes to certain types of medical products that are absolutely essential to treat the virus or to protect healthcare workers from the virus, that we have prices that are kept stable so that you don't have those entities that are able to actually manufacture and supply things like the N95 masks and the respirators at grossly inflated prices. And so that would be illegal for them to sell anywhere, not just in the state of Michigan, but to sell that across state lines. So that's something that we're working very, very hard on. But there's a number of other things, and if I can just point to them before I'm off here. Not like NAG and DAGA have been really on top of this. One of it has to do with, with an effort by a bipartisan coalition of attorneys general who on April 13th, we called on the U.S. Department of Treasury to take immediate action to ensure that the billions of dollars in these stimulus payments are not subjected to diversion for debt collectors. I mean, a lot of people owe money for all kinds of things, right? And whether it's prior medical debt, whether it's student loan debt, all different kinds of debt that people in the ordinary course of life incur, we don't want to see this money garnished, because what's the point, right? What's the point? This money is supposed to go directly to people to help them with things that are essential for their survival, like food and medicine. And if it's going to be diverted and just go to debt collectors because you owe money on your credit card or something, what's the point of the government doing it? They just might as well just send it right away to those various companies that at some point have some sort of garnishment or lien that's been levied against an individual. So that's something that we did, and we're really hopeful that that will be impactful. Let me see what else. I think that's something that we did just recently, but we have a number of these other things. But we can send you the letter that we are hoping to send out to Congress. Again, I'm hoping to get it out on Friday. That would ensure that. I mean, listen, of all times and all types of equipment, It reminds me a lot of how shocking we all saw it to be when the price of EpiPen went up, right? Like or the price of insulin. I mean, these are the types of medical products that people absolutely need to not die, right? And how is that any different from, the types of equipment that we see now and that are so desperately needed to combat the virus and that our healthcare workers need so that they can stay healthy? And so we think it's really important to ensure that this is not an opportunity for businesses to make money. It's not that we want businesses to go broke. We want them to be able to obviously make a living, but not at the expense of people who desperately need those products to survive. And so that's something that we're really working actively on as a coalition of attorneys general.
Great. I just got this message from one of my colleagues, so I wanted to see your response to it because I understand Whitmer was also having a press conference around the same time. Apparently, over 200,000 Michiganders have signed a petition circulated by conservatives to recall Whitmer based on what they call, quote, excessive quarantine. So I would just love to get your response to that.
Well, firstly, I mean, I'm not certain of the legitimacy of actually 200,000 signatures. That would surprise me greatly. And, I think for people who are upset, let's face it, this is hard for everybody, right? There's nobody, irrespective of who you are. I don't care how much of an introvert you are, even. Like, there's no one who finds this easy. This is a complete and total disruption of our everyday lives. I mean, for people not to be able to even see their own family members, it feels very repressive. And I understand that feeling, but I think it's so important that people understand that, this is about protecting people's lives, period. That is all this is about. And the last person who wants to be having to restrict people's freedom at this time, in terms of who they can associate with and what kind of business they can do, or anything of that nature, is our governor. But we have to understand there's nothing more important right now than saving people's lives. And what I think is going to happen, honestly, is this. I think when the dust settles on this, there probably will be a lot of people that won't understand, won't be very clear on, why didn't I contract COVID-19? Or if you did, why did you survive it instead of succumbing to it as, thousands of Michiganders now already have? They may never know that. And all they may remember about this period in time is that their lives were disrupted in a way that was uncomfortable or unsettling or upsetting to them. But to me, if at the end of the day, we have thousands and thousands of people that are permitted to go back to work and go back to seeing their friends and their family and go back to school, and never had their lives cut short, and can go about the process of rebuilding their future again, then Governor Whitmer will have done her job, and she will have saved thousands and thousands of people's lives, even if they never really understand it or appreciate it. And to me, that's what leadership looks like.
That's a great note to end this on. Thank you so much for your time. This has been super helpful and informative, and I'm glad to get to know you a little bit better and hear from you.
Yeah, anytime. I love the work you guys do. I should just tell you, I watch your videos every single day, and they make me cry much of the time. I don't know if that's what you're going for.
Yeah.
But I love your work, and I mean, what a great outlet to work for. So anytime at all that you want to talk about anything Michigan oriented or that we have some sort of impact on, please get back in touch with me, okay?
Thank you so much. I really appreciate that.
Be safe, okay? Be healthy.
You as well. Thank you. Bye.